is the concept of duct ectasia. Now this is what is very important. 99% of the people try to understand duct ectasia without understanding it, and hence they land up mugging. When we talk about duct ectasia, the classical thing that we need to understand is what is duct ectasia. It is dilation or dilatation. This is what is very important. So dilatation of lactiferous duct or ducts in association with the chronic inflammation. Now, who could be a source of this chronic inflammation? Due to the lifestyle related changes, more and more patients are addicted to, or more and more patients are presenting with a classical addiction to smoking, or nowadays, the endemicity of the diabetes, or rather epidemicity of the diabetes. So diabetes mellitus, and they are the chronic source of inflammation or infection. Apart from that, it's a classic triad of dilatation of ducts, and there is nipple discharge. So when we talk about the nipple discharge, we have three kinds. The most common type is the serous. I'll explain all the things. So the most common is serous. The most specific kind of discharge is the greenish black discharge. So this is again very important, greenish black. And remember, other pattern of discharge associated with erosion of the duct is the what, students? Is the bloody discharge. Apart from that, we also develop what? Nipple retraction. And what kind of nipple retraction do we develop, students? We develop the slit like nipple retraction. I'll explain each and everything, don't worry. What is the classical management for them? So just trying to create an overview. The classical management is Hatfield or Hatfield cone excision. So when we talk about Hatfield's cone excision or radial excision, so what is this concept of radial excision or Hatfield's cone excision? Let us try to understand it. So I will explain you the concept of or etiopathogenesis of duct ectasia. Do you know that duct ectasia is the most common cause of nipple discharge overall? And let us take an example in context with the smoking. So when we talk about smoking, it is very, very common to understand that smoke releases lethal MMP. So what is MMP? Matrix metalloproteinase. And this matrix metalloproteinase, it initiates intense inflammation. And where it initiates the intense inflammation? Around the lactiferous ducts. So do you know that lactiferous duct, they contain the what kind of epithelium? The cuboidal epithelium. The cuboidal epithelium is loaded with the tubules, and therefore due to inflammation there shall be what, students? There shall be discharge, and this discharge will be of what presentation? Serous discharge. And this is what is very, very, very important. The moment there is inflammation, there is increased risk of what, students? Infection. And the moment there is increased risk of infection, the infection superadds on this serous discharge and results in a what, students? In a greenish black nipple discharge. Now try to understand how the changes are happening with the, you can say, the stage. So greenish black discharge is happening as the intensification of the inflammation happens. So as there is progress of this inflammation, there will be two things. There will be erosion of the duct, and along with that there will be thinning of the duct. So since there is erosion and thinning of the duct, there will be two changes. Because of the erosion, you will have what kind of discharge? You will have the bloody discharge. This is one thing. So now you can understand how the discharge happens. And because of this thinning of the ducts, you shall have ectasia. So this is the reason why ectasia happens. Everything except the broken heart will heal eventually with the time. So happens with this also. So over the time, the healing happens. And do you know that healing happens with the fibrosis? And do you know, as the fibrosis happens, the core concept of fibrosis is cicatrization. And in a layman's language, what is cicatrization? It is nothing but contraction, and this is what is very, 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 very important. Try to understand that all the ducts which are radially arranged around the nipple areolar complex are also attached to the nipple areolar complex. And as the healing happens with the fibrosis, do you know what will happen? There will be cicatrization. The moment there is cicatrization, there will be an inward pull on this nipple, and the moment there is an inward pull of nipple, you will see something like this from the top, or from the front you will see something like what, students? This is a classical slit like nipple discharge, a slit like nipple retraction. So this is why we see a slit like nipple retraction. What is the classical management for this? And let us try to understand. We'll make a D-shaped semicircle incision and try to put up the nipple up. So elevate the nipple, and elevation of the nipple will give you an access inside the breast. And now go for what kind of excision? Radially the ducts are arranged, and this is how the radial excision is done. And can you see a cone shape based excision? And that is why we say a what? A radial excision or a cone excision. So this is the reason why we do, or what is the need for this. Along with that, shaving of under surface of the nipple. So shaving of the under surface of the nipple is very important. Lot of people may, you can say, omit this step. Lot of people do follow. So radial excision of the entire ductoglandular assembly, because if you leave a duct thinking that it's a discharge from a single duct, the recurrences ought to happen. So this is what is the classical concept of duct ectasia.